Hi, this is Ralph Moss, and the reason I'm smiling is because I just finished my 44th session of radiation therapy for prostate cancer. That's a lot of sessions. It stretched out over more than 2 months. We missed a few days for technical reasons, and so it was the better part of 2.5 months of pretty constant treatment, 5 times a week on most weeks. So we won't know how effective the treatment is for half a year or a year from now. And in fact, from what I have read, the treatment still continues to operate sort of in the background. Radiation is a lot more complex than people thought just a few decades ago. In other words, it's not just about destroying the DNA within the tumor, but it also has immunological effects, beneficial effects in terms of the immune system, and some negative ones as well, I'm sure. I will do a follow-up blood test in order to see what effect the treatment had on my lymphocytes. I was a little bit surprised that the doctors are not going to order that. They don't seem to be terribly concerned about that, and I don't know if that's because of their experience or if it's just not within their, their point of view in terms of the treatment. But I will do my own follow-up and work with my primary care doctor and so forth. I think that the treatment overall is very tolerable. It's not without side effects from my experience, but don't forget I also had the what's called the spacer, the hydrogel spacer that was injected into me before I began the treatment, and that's supposed to diminish some of the side effects by, you hear different estimates, but maybe 30% less. Some people say even more than that. And I think it worked very well in my case. Nonetheless, you do have some, or I did have some side effects, and I expect those to linger for a couple of weeks. There's actually a reference to this very problem in the famous DeVita cancer textbook, and they sort of glancingly mention that the acute side effects should diminish after about 2 weeks, which would work out just fine for me. And if you see the video of my leaving ceremony, the ringing of the bell, you can see that, a good time was had by all.
There you go. Good job.
I developed a really good, close, friendly relationship with the technicians who administered the treatment, all of whom were just wonderful to me and to everybody else, I think, also. And you get to know them and you learn a little bit of their lives and what their work schedule is like and so forth. So it's quite interesting, sort of the inside baseball of radiation treatment. But all of that went well, and I feel good. I mean, I only feel a little bit sort of out of my normal routine, and I haven't been exercising very much. And, there was a period there sort of in the midway point where I was very lethargic and had to sleep a lot. But contrary to what I was led to believe, that tiredness actually diminished as I got closer to the end. Maybe it's just psychological because I was very much anticipating, counting down the days, as it were, till I was done with the treatment. But if you're facing radiation treatment, my message would be not to be too fearful about this. There are some challenges to overcome, especially in terms of your GI tract and the fact that you have to, do these filling and emptying. I won't get graphic about it, but you have to do certain things in order to make the radiation as effective as possible. But by and large, it's not an unpleasant thing. In some odd ways, it's actually pleasant, if you have a nice situation to go to and people are friendly and everybody is cooperating and rowing in the same direction as it was, and the medical staff was perfectly adequate to my needs, the nurses, the doctors. We had weekly meetings, and sometimes we didn't have that much to even talk about because it was just sort of status quo ante, and we just kept on going with it. But at the same time, I can be happy that it's over. I believe it was very successful, and it's going to prove to be very successful. I still feel it was the right treatment for me, although I realize that for a lot of people, it would be overtreatment, depending on the type of prostate cancer that they have. Not everybody needs to be treated. And, it's a cliche, but it's true that this is very much an individual decision, and every case is different. So you'll have to sort of search your soul to see whether or not this is the right treatment for you, and in consultation with your doctors, of course. For me, because of just the particular unusual characteristics of, the fact that I had cryoablation before and so forth, this created some question marks about how exactly I should be treated. But in the end, I feel confident that the 3 doctors, the urologists that I consulted on this question, independent of one another, came up with basically the same prescription, the same advice, and I think it was a good one. So anyway, here I am. I survived, and I'm feeling good, and on with the show. Great being in touch with all of you, and thank you so much for all your wonderful comments to me. Very, very important and very helpful to feel that you've got other people have your back and are rooting for you. It's a huge psychological boost. So again, thanks for all the people who made comments and sent me good wishes. Well, till the next podcast, this is Ralph Moss.